Okay, the question is there a difference in billing and coding for, I don't know what that means.
The locum?
Locum provider.
I'm on
Okay,
top of it.
I thought that means my eyes. Who stays in an organization for a week compared to a locum that is there for 2 months. Can you discuss the Q6 modifier and any tips to make the billing and coding locums not as confusing? Okay,
You want
Jennifer.
me to go?
Yeah, because I ain't got a clue. I guess you guys don't know, but maybe I've said it before. I don't particularly like billing them.
I don't like billing.
I really had to do it for like a year, and I was like, I was very glad to get out there.
Well, this is, of course, in the Medicare manual. So if you ever need to know something, just look there first. So locums, they don't call it locums anymore. It's called fee for time now, but most people still refer to it as locums. Locums is when your provider is either out on maternity leave, doing some kind of sabbatical, research, anything where they're going to be out and they need somebody to take their place. So another provider who doesn't have a practice, they just kind of travel around or do, maybe they used to be in practice and now they just help people out. So it's usually somebody who doesn't have their own practice is going to come in temporarily while a provider is out so that there's a continuity of care still with their patients and they don't have to have other people in the office try and get the burden for somebody who's out long. You think of maternity leave, they're going to be out at least 6 weeks. So you have some time there that you don't want those patients to not be seen. So a locum will come in and see them. Now the difference is they now call this fee for time. So think of it that way. The provider who is out, so you have a provider on maternity leave, that provider is paying that doctor to come in and see patients. So you're not billing your claim under Dr. B, you're doing pregnant Dr. A. So pregnant doctor is going to be on the name of all your claims. So that's why we include the Q6 modifier. So that way Medicare or any other provider knows that this person who's on this claim form hired somebody to come in and see their patients because they happen to be out. So these are not incident 2. These are normal physician services, so they can see a Medicare patient and diagnose them for the very first time. They don't have to work under a supervisory provider. Now, there is a restriction of 60 days. So in Whitney's, in this question, there's no difference between a week or 2 months. You're still doing the same thing. It's for a length of time that the provider isn't there. There is a 60-day limit. The only way they waive that limit is if that doctor is fulfilling their services with the armed forces. So they are called up to duty or something like that, and it's going to go longer than 60 days. That's the only case that they allow a fee-for-service provider or locums to go longer than 60 days. So you can have a provider come into your office up to 60 days. You still bill under the name of your own doctor with a Q6 modifier on there.
That's really cool. I did not know any of that.
Oh, it's for physical therapy too. So not just doctors, but also physical therapy. So, yep.
Does it work for nurse practitioners and PAs or no?
Well, no, because they bill typically incident 2. Under Medicare rules, they're billing incident 2. So this is mainly coming from Medicare.
Do you need more medical certification and business training? Learn more at www.cco.us.